Welcome, future nurses. We're about to tackle one of the most critical, high-stakes topics you will ever face on the NCLEX, antidotes. And let me tell you, this is not about rote memorization. It's all about patient safety. So let's get you feeling totally confident with these questions.
And this quote? This is everything. This is the whole philosophy. The NCLEX isn't just testing your knowledge of a drug. It's testing your judgment. Can you see a crisis unfolding, and can you act fast enough to stop it? That's the mindset you've got to have.
So here's how we're going to do it. We've broken this deep dive into 6 parts. We'll kick things off with a fundamental rule. Then we'll get into the must-know drug pairs, run through some quick reversals, and then, and this is key, we'll look at it all through the lens of the next-gen NCLEX. We'll wrap up with some memory tricks and a final check-in. You ready? Let's go. First things first, let's talk about what I call the NCLEX Gold Rule. Seriously, this is non-negotiable. If you feel like you're drowning in drug names, this rule is going to be your lifeline. It tells you exactly where to focus your study time for the biggest possible payoff. Here it is. It looks simple, but it is so powerful. If a medication can mess with the ABCs, airway, breathing, circulation, then you can bet it's high yield for the exam. The NCLEX absolutely expects you to know how to reverse these life-threatening situations. This rule just cuts right through all the noise.
All right, now we're getting into the real meat of this explainer, the critical pairs. These are the drug-antidote combos that pop up again and again because, you guessed it, they tie directly back to that gold rule we just covered. We're going to break them down one by one.
Let's start with a huge one, opioids and naloxone. Okay, picture this. Your patient's respiratory rate is under 12. They have those classic pinpoint pupils, and they're barely responsive. Your internal alarm bells should be screaming. Priority number 1 is breathing. You give naloxone because it directly reverses that respiratory depression. Now here's the NCLEX trap. They'll give you an option to just put on some oxygen or wait for labs. No way! That's a dangerous delay. You act.
Next up, an old classic, warfarin. The big clues for toxicity, an INR over 4 and signs of bleeding. Think bleeding gums, blood in the urine. But here's where the clinical judgment comes in. If the INR is high but the patient isn't actively bleeding, you're going to give vitamin K. But, and this is a huge but, if they are bleeding heavily, vitamin K is way too slow. That patient needs fresh frozen plasma, and they need it now.
Staying on the anticoagulant train, let's hit heparin. For this one, you're watching the APTT. If that number is through the roof and your patient is oozing from their IV site, the antidote is protamine sulfate. The NCLEX loves this next little detail. Protamine sulfate works perfectly for regular unfractionated heparin, but for low molecular weight heparin, it only gives you a partial reversal. That is a classic test question right there.
Insulin, if there's too much on board, it's going to lead to one place, hypoglycemia. We're talking blood sugar under 70, shakiness, sweating, you know the deal. But your intervention changes completely based on the patient's status. Are they awake and can they swallow? Great, give them some orange juice or glucose tablets. Are they unconscious at home with no IV access? That is the textbook scenario for a glucagon injection. In the hospital with an IV ready to go, you're pushing IV dextrose. You see, the NCLEX wants to know if you can pick the right tool for the job.
Digoxin. This drug is so powerful, but it has such a tiny therapeutic window. The classic toxicity signs are a slow heart rate, nausea, and vomiting. But the one they love to put on the test is the weird visual change. Patients complaining about seeing yellow-green halos around lights. And you absolutely have to connect this to potassium. Low potassium, or hypokalemia, makes digoxin toxicity way more likely. When that happens, the specific antidote is digoxin immune fab or Digibind.
Magnesium sulfate. You see this a lot in OB for preeclampsia, but it's a major central nervous system depressant. So if your patient's breathing slows down to less than 12, and this is the big one, they lose their deep tendon reflexes, you have an emergency on your hands. That's mag toxicity. The antidote is calcium gluconate, and you should always have it at the bedside for these patients. And in a true emergency, you act. You do not wait for an order.
Okay, deep breaths. You've got the major pairs down. Now let's switch gears and pick up the pace. We're going to do a rapid-fire round to really lock in some other essential antidotes. The goal here is just to make that quick connection. Drug, reversal. Drug, reversal.
Ready? Benzodiazepines like lorazepam, reversed by flumazenil. Acetaminophen overdose, you've got to give acetylcysteine to save that liver. Iron toxicity, super common in kids, treated with defurazamine. Beta blockers causing a dangerously slow heart rate? The surprising answer is glucagon.
Calcium channel blockers causing the same thing? That's calcium gluconate again. And for that crazy anticholinergic toxicity, hot as a hair, dry as a bone, blind as a bat, red as a beet, mad as a hatter, the antidote is physostigmine.
So, we have covered a lot of what to know. But the next-gen NCLEX is all about how to think. It's not going to be enough to just match a drug to an antidote from a list. You have to apply your clinical judgment.
And this right here is the big shift. The NGN isn't just going to ask you for the name of the antidote. It's going to paint a whole clinical picture, and you'll have to think through every step. Can you even see the early signs of toxicity? Can you pick the right drug? Do you know if you should give it now or later? Do you know what better looks like after you give it? And most importantly, can you avoid any action that wastes precious time?
To help with that, I want you to burn this 5-step checklist into your brain. On exam day, before you click any answer, just run through this real quick. Is my patient unstable? Are there clear signs of toxicity? Is this situation life-threatening? Am I picking the right antidote for this specific problem? And finally, will what I'm about to do help their airway, breathing, or circulation? If you can say yes, 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 then you can act with confidence.
And here's a serious warning. The NGN scoring is different. You can actually lose points for making an unsafe choice. Picking the wrong antidote or deciding to wait for labs when you should act now, those are classic unsafe actions. Doing the right thing gets you points. Doing the wrong thing can actually take them away. The stakes could not be higher.
I know, this is a ton of information. So how do we make sure it all sticks when you're under pressure? We use simple, powerful memory anchors to lock in these critical pairs. Let's just run through these. Opioids stop breathing, so you give naloxone. Magnesium stops reflexes, so you give calcium. Insulin drops sugar, so you give glucose. Warfarin thins the blood, so you give vitamin K. And digoxin poisons the heart, so you give digibind. Seriously, these simple little phrases can be your lifeline when you're looking at a question and your brain just goes blank.
All right, this is it. Time to put it all together. You've got the rule, you've got the pairs, and you have the thinking process. Now it's your move. Let's tackle a classic NCLEX-style scenario.
Okay, take a second. Don't just jump to an answer. Use that decision filter. Is the patient unstable? Yes, a respiratory rate of 10 is very unstable. Are there signs of toxicity? Yes, absent reflexes are a huge red flag. Is it life-threatening? Absolutely. Respiratory arrest is right around the corner. So what's the antidote for mag toxicity? You know this, it's calcium gluconate. So your priority action is to stop that infusion and administer the calcium gluconate. That's the correct and safe move.
And that really brings us to the final, most important point. Everything we've covered today. This isn't just trivia for an exam. Each one of these pairings represents a critical life or death safety decision that you will be empowered to make as a nurse. Knowing this stuff isn't just about passing the NCLEX, it's about being ready to save a life.